Thank you, Team Surat 2025, for inviting us and to discuss, giving the opportunity to discuss on this uh, very unusual topic, what I say, that is end of life care. Uh, Very important, but I think neglected, not giving much importance in day-to-day practice. So this is our department, our team, and first we'll understand what is end of life care. Assume all those who are working in ICU is well versed with the end stages of life. That is what to do. Any patient is improving or definitely dying, we all know. But what to do when we are helpless or we know that the disease is irreversible, it is not going to improve with the, or patient is not curable now. So these are the stages of dying from green to the later stages. So what Roger Burns said, dying can be a peaceful event or a great agony when it is inappropriately sustained by life support. If you go on prolonging the life, just patient, because patient ICU માં છે એટલે બધું કરવાનું, બીમારી મટે એવી છે કે નથી, we are not bothered about it. But that is not the correct way. So, due to lack of time, I will discuss only the particular point which is important in day-to-day practice. First of all, let me ask all the audience, how many of you are aware about the rules and regulation of end of life care? કોઈ પેશન્ટ એમ કે મારે વેન્ટિલેટર કાઢી નાખવું છે, તમારો જવાબ શું હોય બધાનો? Will you allow it or no? How many of you allow it? No? Okay, so many, I presume, even હું એ જ વિચારતો હતો, but there are so many rules and regulations and it is legally valid. How it is valid, we'll see. So there are dimensions of end of life care. There are laws, hospital policy, societal, cultural and religion, the beliefs of relatives and individuals, and most important is our attitude, the treating team's attitude, the doctor's attitude. So we'll start a case. This is a real case. 3 months ago, we came across in our ICU. 82-year-old male, multiple comorbidities. After dinner, sudden chest discomfort, became unconscious. As usual, some sugar and water given by relatives. Brought to our hospital after 20 minutes. On admission, patient was pulse BP-less. CPR was done in trauma. ROSC achieved after 25 minutes. Shifted to our ICU. As usual, on ventilator, support. Post-cardiac arrest care has been started. Remains same neurologically after 5 days of treatment. Patient was unconscious. MRI showing hypoxic brain injury. What relatives will happen, what are the likely possibility and poor outcome? They have two options, either to continue the treatment, whatever it is, or may they want to, because of the poor prognosis, they may ask you કે બધું કાઢી નાખો, હવે આટલા દિવસ કર્યું, હવે નથી લઈ જવું. Which one is correct? And which one is legally accepted? Gopal Bhai. I'm trying to go little fast because the time is very less.
First of all, that considering his conditions, prognosis, proper assessment, and then you mentioned that the hypoxic brain damage, so you have to go with the institutional legal aspect and the process. And
Yes.
as the recent that knowledge that you can give the option to the patient of the end of life care, and you have to assess that whether what kind of advanced directives, ADA, whether patient
Yes.
wish that comparing to his dignity and the things. So if it is available, then you can proceed to remove the ventilators. Proper counseling should be done, and you can give the patient option that whether preserving the life or the prevent the suffering. And after proper discussing, then you can take a call for the removing the ventilators.
Yes, very correct. Patient wish or advance directive if we have, that plays a key role. Sunil bhai, any other idea?
I think the first of all, we have to look at the prognosis of the patient, whether the patient is irreversible stage of the recovery or not.
Yes.
As it was mentioned in this slide, patient 5 days has passed by, neurologically is not doing well, post cardiac arrest patient. These are the patients, I think neurologically they won't do well. So once we identify either the patient is terminally ill or having very, almost negligible chances of recovery, these are the stage when we think of implementing the end of life care as per the Supreme Court 2023 guidelines.
Yes, correct. So ideally, such kind of patient should be offered if after extensive discussion with the relatives, taking them in confidence, we should discuss with the end of life care how we'll go it. So whatever you are doing, as Sunil bhai, Gopal bhai has said, we will discuss with the relatives, advance directive is there or not. It is ethically and legally acceptable? Ritesh bhai?
Answer is yes.
Answer is yes. On what basis?
See, it's a myth that you cannot remove ventilator. Please, all of you, remove that fear from your mind that you cannot remove ventilator. Remove that fear from your mind that someone else will, torture you tomorrow and say even patients' relatives that tame ventilator કેમ કાઢી નાખ્યું તમે અમારા બાપાને કાકાને મામાને મારી નાખે. No, no, no. Provided, number one, you should be as a team confident, as Dr. Sunil Bhai said, right? Number two, see the correctable cause, if at all, or reversible cause. Number three, once convinced, you are convinced, you convince to relatives. And number four, if relatives get convinced, put everything on paper, documentation. And then you can go ahead and remove ventilator. There is no issue. Ethically, I would say it's other way around, that if I'm continuing treatment, I'm ethically wrong, right?
Yes.
What am I doing? As a doctor, what we want, that patient should be all right. And we know that patient is not going to be all right. So by continuing treatment, probably we are doing ethically horribly, terribly wrong. Legally, we are safe. There is no issue.
In short, we are prolonging death.
Yeah, so first of all, congratulate Team Karam sir by achieving ROSC at 45 minutes. So it's very difficult, not everyone can achieve ROSC at 45 minutes. So your effort is excellent. So first and foremost, for withdrawing any support, first you have to think about what is the prior quality of life. She is 80 years, multiple comorbidity. If she is bedbound, and sometime what happened because of social problems, these type of patient may land up into hospital. If there is a smart people over there, then they might accept this thing and they will never bring to hospital. So if we know by the history, if this type of issue is there, so initially we have to be very vigilant in providing care to this type of patient. And even though if we achieve ROSC, then if we are not providing a meaningful quality of life to this type of patient, then we upfront discuss with relatives about this procedure.
Yes, very correct. So what is end of life care? As all the panelists, you must have got some idea. It is an approach in terminally ill patient that shifts the focus of care to symptom control, comfort, dignity, quality of life, and quality of dying, rather than treatment aimed at cure or prolongation of life. Treating team or the treating physician is confident that this illness or this disease is not going to improve, unnecessary, we are prolonging the death, not a life. There is no meaningful outcome, no meaningful recovery. Don't continue. Frankly, discuss with the relative and find out a solution. We are skipping all these things. So we know when to discuss with the end of life care with the family and how. Once treating team or treating physician is confident with all investigation and the clinical examination, that patient is not going to improve, the disease is terminal, then end of life care issues with the, should be discussed with the relatives. So there are legal and policy framework in India also. Someone was, when I asked some, was saying that you cannot withhold or remove the ventilator. But now, legally, we are safe. If we do, as per the guidelines given by the Supreme Court, no one can stop you from removing the ventilator. So there are lots of work has been done. Legal evaluation, if we go by 2006 to 2023, or 24, I can say, initially it was rejected by the law or government in the court. The famous case of Ms. Aruna, everybody is aware about it. Then after the advance directive or the, what we call as a, they don't, you want to use the word law, the euthanasia, but the end of life care, they have made a certain guidelines, certain protocols, certain legal formalities that has to be fulfilled by the treating doctor or the hospital team. Then you can, of course, safely you can go ahead with it.
Slides.
Slides change kar do.
So, rightly says.
Sorry? Yes, yes, please. Just.
End stage malignancy critical care, and he's definitely going to die, but relatives say that no, we will take the dead body only, but we want to keep this patient, and they are ready that you remove the ventilator also. But we all know that by removing the ventilator within 5 seconds or minutes, patient is going to die. Then what to do in this situation? Though we take the consent also that we will not give the COD also, cause of death also, if you want to take the body also. It is not in Dama and Lama, then we have to give the COD also in this patient. But what we have to do in such cases?
We'll come to your case.
Yeah.
We'll
Thank
just,
you.
You will get your answer after this session.
So one thing about that discussion with the family about end of life care, it's also depend upon age factor of patient also, the nature of illness by which patient land up in this situation, that is important. Like 80-year comorbidity, then it is totally different. And when you receive a very young patient having cardiac issue or maybe pulmonary embolism or any other issue and they get these type of arrested situation, then these two age and other comorbidity factors we have to take care in our mind. Then we start counseling regarding else this type of situation.
Yes, you have to be very careful in discussing with the family members. You have to know the some background, the patient profile, as Gopal Bhai says, the pre-existing condition also. There's so many factors. Even the biggest is our cultural and their family beliefs, what they believe.
So not in hurry or not
No.
too late.
No,
These
no.
are the important things.
Yes.
Day-to-day, that proper day-to-day counseling is the most important. In such case,
Yes.
you have to explain and what is your plan for the treatment and what patient is going to get the benefit. Everything has to be explained. Particularly if the patient having comorbid condition, then it won't be a problem. But the acute arrest and following that neurological outcome, you have to do this.
Yes. And Sunil bhai, any idea about advance directive and its validity,
Yeah,
especially in India?
as per the Supreme Court 2023 guidelines, the advance directive can be written by the person who is in full conscious state of mind. He understands what is happening. Like it's a living, whether he wants to undergo that thing in the future or not. Suppose if I don't want to go on the ventilator, I don't want any advanced mode of the therapy to be given to me, especially when I come to a stage when won't be able to take a decision. I can write an advance directive mentioning regarding the same. And it's valid in India. There's a way to do it. Like, previously it was told that when we make the advance directive, the judicial magistrate has to be there to write the advance directive. Now the rules are becoming lax now with 2023 guidelines. The person who is competent state of mind can frame the advance directive in the presence of two witnesses, and the
Yes.
same thing should be signed by the gazetted officer. I think that is the legally applicable advance directive, which further should be given, ideally should be submitted in the online healthcare. One should be given to the personal doctor who is treating him, and the one should be given to the surrogate. Surrogate means the witness who are signing it. These are the 3 copies, I think, which should be submitted whenever the future event happens. These are the advance directive which will decide about the further course of action.
Yes. So, I think it is clear what is advance directive. જે પ્રોપર્ટીનું વિલ કરે છે લોકો એવી જ રીતે પોતાની હેલ્થનું વિલ કરે કે મને સર્ટેન કન્ડિશન આવે કે સર્ટેન જ્યારે ઇરિવર્સિબલ આવે વેન્ટિલેટર મૂકવાનું નહીં મૂકવાનું કેટલી હદ સુધી મારી ટ્રીટમેન્ટ કરવાની ક્લિયર અનફોર્ચ્યુનેટલી 95% કેસમાં આપણે ત્યાં આઈસીયુમાં કે જે આવે છે જે પેશન્ટો જે આવા ટર્મિનલી દે ડોન્ટ હેવ એડવાન્સ ડિરેક્ટિવ એ મોટા ભાગે the decision taken by the family members or next of kin. So it is little tricky and difficult for us. If advance directive is there, it's available, our job is very easy because no one can go above it, not even a family member. Okay. So what is, Ritesh bhai, what is the difference in withdrawal and withholding of treatment? Are they same and legally valid or not?
See, they both are slightly different. That withdrawal means if patient is on ventilator or life support, you are actively removing it. And withholding means the same to continue but not to escalate. Majority of the time, all of us, we practice more and more withholding. And that actually is a routine practice. So there is only thin margin. Only fear is there in between. Otherwise, practically, there is no difference. All right?
Is it legally valid?
Legally 100% valid. Now, withdrawal is also 100% valid, as Sunil bhai rightly says. The problem is that advance directive, I'll just add one. It's a big dilemma. આપણે ત્યાં કે કઈ આની સામે પડું કોર્ટમાં જવું છોડને એના ઇન્ટ્યુબેટ કર ભાઈ જોયું જશે
Legally you are correct, પણ માથાકૂટમાં કોણ પડશે?
માથાકૂટમાં કોણ પડે so this is also but I would say in between the line if patient is having advance directive and by relatives say if you have
They will see the patient, examining, and the case within 40 hours will be handed over to secondary medical board. What is secondary medical board? One registered medical practitioner, એ ક્યાંથી આવશે? Will be appointed by your primary medical board, secondary medical board. બંને બોર્ડના opinion should be you should have it within 48 hours. બંને વચ્ચે જો એગ્રીમેન્ટ થાય પ્રાઇમરી મેડિકલ બોર્ડ સેકન્ડરી મેડિકલ બોર્ડ then the decision conveyed to family અને પછી જે ડિસિઝન લેવું છે withdrawal you can take. આમાં ડિસ્પ્યુટ હોય પ્રાઇમરી મેડિકલ કે સેકન્ડરી મેડિકલ બોર્ડમાં તો પછી એ મેટર ક્યાં જશે આગળ? કોર્ટ. ક્લિયર? હવે મેડમ તમારો એક પેનલિસ્ટ વિલ આન્સર ઇટ. આમાં કોઈને ડાઉટ? પ્રાઇમરી મેડિકલ બોર્ડ સેકન્ડરી બોર્ડ સો તમારી હોસ્પિટલમાં what you have to do is ask your management to form a primary medical board and secondary medical board. Whenever need arises, that can help you out. Challenges, we are not going in much detail, lack of time, but some important questions we'll take. Yes. What about the health insurance and the
So, first of all,
general insurance? The person in whom we have removed the ventilator, what will happen to health insurance and life insurance?
so I think passing of insurance is not a liability of doctor. First is insurance will pass depending upon their policy. So as per we have seen, it is mandated by the government of India also. So Supreme Court has also provide provision for doing this activity. So I think if you provide enough cause of death that is justifying patient illness, current illness, then I don't think there is much conflict regarding passing of the insurance. But if you mention such a thing that is already existing and patient had hide, like malignancy, they are suffering from malignancy since 2 years, and if you write a cause of death of malignancy, then there are chances because of not disclosing the disease, insurance might delay or insurance might be rejected. So insurance passing is depend upon which type of policy and whether they have pre-existing disease they have mentioned or not, then and only problem. Otherwise, current illness related, no issue if we are providing a cause of death.
Gopal bhai.
What Dr. Amrish is telling, that should be a proper transparency should be there. Everything has to be documented properly and the things and explainable. Then and then I don't think so insurance people or health insurance people, they will have any problem.
Yes, I think insurance should not be an issue.
Terminated because
Yes.
of withdrawal.
Yes.
Of
Can we mention
course,
official
yes.
paper?
I'll give you an example in health insurance, not the term insurance, life insurance. In health insurance, the insurance company will be happily give, કારણ કે જો continue થાય તો વધારે પૈસા આપવા પડશે. So we are helping them.
Yeah, but in life insurance, sir.
Life insurance depends on policy, but with this, legally, there is no issue.
Thank you, sir.
We have all the documents and consent. And we are going as per the guideline given by the Supreme Court. So I don't think that should be any issue.
Madam, you have to properly document all the steps which we have followed, exactly what Dr. Samir told.
Yes.
So if you have documented it well, I don't think there should be any issue.
Thank you, sir.
Thank you, everyone.
Thank you.